Hello. Hello, I'm Dr. Kave, a Stanford and Harvard trained anesthesiologist and integrative medicine specialist. And we're going to talk about the demanding or challenging or difficult patient and what happens to them when they're under anesthesia. And why do doctors and nurses label these patients as difficult or challenging in the first place? Firstly, I'm not blaming any patients. I don't want anyone to think that we're blaming patients for having fears or reasonable anxieties before challenging and scary medical situations like surgery, where I treat patients the most. As an anesthesiologist, I see patients in the most scary moments of their lives before they give up total control of their body to me and to the surgeon for them to go through this potentially fearful, terrifying experience. It can also be healing, like we've talked about in so many other videos. But when somebody comes in with certain demands, the most common ones and the ones that I'm going to share with you from some recent patients, I'm not laughing at the patients, but just recognizing that these are realities that we all can struggle with if we're not prepared for them. A patient that absolutely demanded that they would get applesauce the moment they woke up from surgery, and the whole center knew about it. Or another patient that wouldn't stop raising their voice at me because they thought I was asking them too many questions about their health before surgery. This is an elderly patient who is at highest risk of surgical complications, and they're upset at me and making it known to everybody around them that the medical staff are all asking them too many questions. Well, what happens to them when they fall asleep? And most importantly, how does this affect their own health? Because while you and I might be talking about this, um, like it's just something that happens to people, for the individuals that come in with these demands, it's very, very different because their bodies are actually suffering and keeping score of the cognitive rigidity that's leading to the manifestation of challenging demands, being difficult, etc. So I want to just want to give a shout out to Mary, Robin, Crazy Cat Lady, St. Bernard Puppies. Excellent, excellent. I hope this stream is now going to not have the buffering that we had a couple minutes ago. So just let me know what questions you have about these stories and if there's any issue with the stream. So let's get right to it. Why do some patients get misunderstood? I'll give you one example. When the patient comes to me saying that, doctor, I am so upset with anesthesiologists and the surgeons and the nurses after surgery because they don't give me the water when I'm asking for it. Well, obviously, I want to know why they felt this thirst after. Maybe they were dehydrated. More likely, they may have had a sore throat from the breathing tube, a dry mouth, from the medications that we give, or just from not being able to swallow under anesthesia. Firstly, we have to figure out what's going on. Maybe they have an autoimmune condition that's preventing the salivary glands from producing saliva to coat the throat. So there might be a medical reason we need to figure out. But the second question is, why is it the first thing that comes to mind? Because when it comes across as like, I am so upset with everyone that does X, Y, and Z, how are we supposed to react? But more importantly, why is it there? What happens with busy nurses and doctors and whoever's is that sometimes they just label that and they move on, saying, oh, they're challenging. But what we need to do instead is recognize, why is it there? Is it a medical reason? Is there maybe a history of trauma where they didn't have access to basic human needs, and that in their body comes out as having dry mouth and moments of anxiety? You can't just sweep this stuff under the rug when patients are undergoing challenging, scary moments in a medical setting, right? But unfortunately, all too often it's just labeled and moved on. The why is so important because it's not a gene. You don't have a difficult patient gene here. There's a reason why it's there, and that reason might be causative for so many other medical conditions: chronic pain, anxiety, depression, PTSD from that event in the past. It's not a gene. You're not born having this, challenging patient phenotype. It's there for a reason. And we don't do right by patients or by ourselves if we don't explore why there is that manifestation of maybe being demanding, ultimately of being cognitively rigid. So I like how Kathy is talking about vulnerable adults from challenging childhood, 100%. Robin Taylor is mentioning that I've been kicked out of an entire medical system because they said I asked too many questions. Robin, I'm so sorry that you had that. You're saying, I just wanted to know everything I could about the chemotherapy I was going to get. Robin, I am so sorry, and I hope everyone here who's listening recognizes that that is not your fault. And I'm just so sorry that in a vulnerable time like receiving chemo, that one would be labeled as asking too many questions about something that's toxic, that's going into your body, to know how to prepare for it, anticipate the side effects so you can treat them preventively, etc. This is no joke, and I'm so sorry that that happened to you. And Chris is saying, woken up from surgery feeling the pain of a combat wound, totally unrelated to the surgery itself. And Mary Fernandez saying, I know Guilford. I used to work at a home care agency in East Haven. Oh gosh, well, a lot of great chat going on here, importantly about what happens in these vulnerable times for ourselves. So let me get to these stories because these are going to be eye-opening about how important these stories are to our physical bodies, not just the mind. Patient one, insistent about applesauce, right? I mentioned this. Applesauce. Why applesauce? Oh, because I have this terrible nausea. My stomach is going to be hurting so much if I don't get the applesauce the moment I wake up from surgery. Well, there can be many reasons for nausea, right? I want to know why. Is nausea because they're getting too many pain medications? Maybe the pain is untreated, and that can also lead to nausea. It goes both ways. Untreated or overtreated pain can lead to that. Is it from anxiety, which we know can cause nausea? There's so many other issues: gastroparesis, history of chemotherapy, et cetera, et cetera. What's the type of surgery? That can also, obviously abdominal surgeries. I shouldn't say obviously, but abdominal surgeries manipulating the bowel can cause nausea. Let's figure out, first of all, why. Acknowledge that this is a legitimate concern, 100%. But why is it that the first thing is that you want to have applesauce? Most patients are going to want to make sure that they're safe, they're comfortable, they're warm, they can breathe. I got to say, applesauce is not one of the most common ones I've heard. I'm not belittling it, but I'm just saying that it's not common. It's there for a reason. Well, let me tell you this. When the patient woke up, after general anesthesia, meaning that they were completely unconscious, they have a breathing tube in place connected to a ventilator that's assisting their ventilation and their breathing, fully unconscious. When I remove the breathing tube, before the memory forming centers of the brain actually come online, so patients, like if you've ever had surgery, this could be you, the breathing tube comes out, patients start to say things and act out things without remembering what they're doing. So you're awake, but you're not necessarily fully conscious. You're not firing on all cylinders yet. What is the first thing that this patient does? They fall asleep terrified about not getting applesauce. Clearly a cognitive rigidity here going on because they need to have applesauce. What's the first thing? Before they ask, did the surgery go okay? How did it go? Thank you. Instead of all these other, I would say, I don't want to say normal, but more common things, first thing comes out of this patient's mouth, where's my applesauce? Where's my applesauce? Okay, I'm not blaming the patient, but I really genuinely feel for somebody whose before their brain is even fully conscious, they don't remember this. Because I asked them later, do you remember the first thing you said? No, doctor, I don't remember what I said. What happens to the body where the subconscious becomes so ingrained in a rigid thought pattern that before the brain is even fully conscious, it is going back to what we label as demands or a difficult patient, this applesauce thing. It's clearly more than just applesauce. And I hope that's what you all appreciate. When we have rigid cognitive loops, rigid behaviors, these are affecting our bodies in ways that even when you're under anesthesia, these reveal themselves when the frontal lobe and the other parts of the thalamus begin to turn on from anesthesia. The psychedelic experience in some cases reveals what these loops are and just how deeply ingrained they are. And without addressing them, it's hard to heal from them. Because if we're just living our lives in a loop, how do we remove ourselves enough so we can look back at the loop, look back at how we're acting and how those actions are preventing our inner healing from being able to heal ourselves? So in the case of the applesauce, yeah, they woke up delirious, screaming, shouting about applesauce, and at the expense of ensuring a safe, comfortable, warm waking experience that helps prevent undue pain in recovery, that helps prevent them from feeling more anxious, which can itself reduce nausea, right? These are all coming at the expense of their health. Let me give you another example, although I do also see a lot of fantastic comments. Let's see. Chris, I totally agree that what Robin experienced about just asking questions about chemo and being dismissed is absolutely inappropriate. And I'm so sorry about that, Robin. And the feelings of betrayal are certainly not, you're not alone. I'm really sorry that happened to you, but I'm also inspired that you're vulnerable to share that with everyone here and to help empower others to not shy away and to better figure out, why is the system viewing me this way? And is there something within myself? I'm not saying you, Robin, but maybe there's something within ourselves, a rigid thought loop that's preventing us from being able to connect with those that at least should be wanting to help us. It's not blame, but it's also a balance of, why is the system viewing me this way? I would hope that your doctors, Robin, when you had cancer, were genuinely trying to give you the optimal chemo. So I got to give the next. Hey, Greg, shout out to you as well. And someone's asking, what would you say to a TKA patient that asks not to have the memory-making ability shut off until intubation? Trick concepts. I'm not quite sure I understand. So a knee replacement patient, total knee arthroplasty, wants to not have midazolam given. If you're asking if someone wants to have the memories up until the moment of intubation, I would absolutely go ahead and do that. Sometimes I don't give midazolam on purpose if the patient wants to experience that letting go phenomena that anesthesia gives us. Remember, with enough anesthesia, you will let go of the urge to breathe. But if you give a low enough dose, you can actually help let go of the fears, uncertainties, doubts that ordinarily keep us bound into rigid thought loops, cognitive loops. And this is why in my psychedelic ketamine infusion clinic, I help patients who don't need surgery do what you're talking about, trick concepts, without giving them midazolam. Let them actually be in the moment and experience what it's like to be removed from living a life governed by maladaptive thought patterns. Robin, I am very happy that you have forgiven them. And I will say that forgiveness, as Dr. Judd Brewer says, is giving up hope for a better past. And what you shared just shows so much maturity and I think so much determination and tenacity to heal. You really are an inspiration to everyone else here, sharing your stories and sharing how you've progressed from them. I want to at least share this other story before we end here. And this is about a patient that, with all respect, I would have to call disrespectful, to not use other words. This was an elderly individual. Typically, elderly patients, not all, but elderly patients have had a lifetime to ingrain cognitive loops in. And this particular patient was intolerant of me asking them questions about their health. Remember, the older you are, the higher the chance of having medical conditions, heart problems, lung problems, etc., that can absolutely torpedo your safety under anesthesia. So I need to do a thorough history and physical for anybody, but for the elderly patient with pre-existing comorbidities, it may even be more important. Well, this individual didn't like me asking them questions. The night before when I called them, they were very upset that I interrupted them. And the morning before surgery, they were also upset. I feel for them. I'm sure there were many reasons that were perhaps a past trauma, perhaps a bad experience in the past, whatever the reason was. I want to say that fortunately the surgery went well, but what happened to this patient under anesthesia. Remember, before surgery, they were upset with me, upset with the others for asking them questions, sick of listing off their allergies. These are important things, but sadly, they were not thrilled with being asked the basic safety questions. Their case was a case of sedation, so it wasn't general anesthesia with the breathing tube, so they could actually speak during the case because they weren't under that deep medical coma that we call general anesthesia. What do you think came out of this patient's mouth when they were just snoozing along? It wasn't gratitude, it wasn't curiosity, it wasn't just a mindful awareness. It was, "Are you done asking me questions? Why do you ask so many questions?" I wasn't even asking questions, but it was so deeply ingrained in their mind that the medical community, or maybe this Dr. Cave, whoever, is just asking a lot of questions, that even when they're in this semi-conscious, semi-lucid state, this is what is in the forefront of their mind, what comes out, right? I'm not belittling them, I'm not blaming them, I'm just sharing experience after experience of how our choices, that we can choose to a large extent, if not fully, where we place our attention. And when we place our attention, or maybe when we don't place our attention in the intention of our cognitive mind loops and our habits that we fall into in stressful moments, clearly these take control of our body in a way that even when we're semi-conscious, this is what blurts out. This is what's demonstrated by maybe delirious actions, by how we talk to others. And it has health consequences, because when patients wake up, for example, when patients wake up and the first thing they say is, "Thank you, doc," or "How did it go? Like, was it, I'm just so grateful for everything that you guys have done. Did my body tolerate the surgery?" When they demonstrate curiosity, gratitude, confidence in the decision to have surgery, boy, I think you will not find a single anesthesiologist out there who will say that those patients are not on the road to a better, safer, more comfortable recovery. It's difficult to be anxious and to be upset and frustrated when you're filled with gratitude and thankful. I'm not saying that I deserve accolades. That's not the point at all. But the point is that when we look beyond the borders of our own mind and our own body and thank others, either humans, or if we believe in a greater spiritual power or a connectiveness with anything else, doesn't matter what, gratitude is almost mutually exclusive. Curiosity is almost mutually exclusive with frustration, anxiety, anger, the things that fuel inflammation in our bodies. We know based on biomarkers, and we know based on dissociation, very strong with chronic pain, with PTSD, etc. So demanding, challenging patients, please, let's not label them that way. Let's try to recognize why that is underlying the way that they speak with medical staff, maybe with their family and friends at home. Because when we can better understand that it's not a gene, but probably a past experience or two or three, or maybe a series of childhood adverse experiences, etc., that have led to these questions that they're asking, we can better take care of them, but we can also help them hopefully lift themselves out of that rigid mind loop and cognitive habit that they are ultimately suffering from within. I'm not saying every patient is going to suffer from this, but highly likely, given the strong associations between depression, anxiety, PTSD, chronic pain. I'm not blaming the patients at all, but these are opportunities of hope and opportunities for intervention to help address the root causes, often without long-term medications needed, to help get to the source. And that's what I do in my ketamine infusion clinic, where I help patients get off of SSRIs and SNRIs and other antidepressants, reduce benzodiazepine usage by helping give them the insights into what the sources of ultimately our suffering is from. It comes out in the operating room, it comes out under anesthesia, and you have more power over your health to overcome those than you've probably ever been told, often without medication. With that said, I hope that everyone here learned a lot. One last question. I'll answer this one from Maureen here. I'm facing another laparoscopy to fix my GERD. I've had trouble with anesthesia before, but I know when I worked with my body and mind to prepare and go through anesthesia, I have far fewer problems. Wow, Maureen, that's incredible. Thank you for sharing that insight, because anesthesia is kind of like a race. If you prepare for a marathon, you'll probably be less likely to hurt yourself and more likely to do it more comfortably. Yet many patients don't recognize that we have to prepare our mind and body for surgery and anesthesia the same way. When we don't have adequate preparation, we don't know what to expect. When we don't know what to expect, uncertainty fuels anxiety. It is the tinder for anxiety. And we know that unmanaged anxiety can cause more pain, increased risk of depression postoperatively, etc. So, Maureen, thank you so much for sharing that. That's fantastic. Wow, and hey, K-Trick Concept says, I want to thank you for educating me enough to make me comfortable rescheduling a surgery canceled by me in April. Wow, I'm wishing you the best there, K-Trick, for your surgery in April. I hope everyone here also sends you positive vibes. And Nadia, I was diagnosed with depression, anxiety, and stress. After recent surgeries, I woke up crying like a baby. Not from pain, but from dreaming about my bosses being rude to me. Nadia, thank you for your vulnerability and sharing that. You are not alone. So many, just yesterday, half of my patients woke up delirious, and I'm not making fun of them. I'm not laughing at them. I'm just sharing that this is a common humanity that we are all in, and your experience is shared by countless other patients because of the realities that rise to our consciousness when we're under anesthesia, when we're in a vulnerable medical situation. You are certainly not alone. Can you dream? Oh, Kathy N, I'm sorry, I didn't see your question. Kathy N, you absolutely can dream under anesthesia. However, when you're given, or if you are given midazolam, that amnestic medication, patients don't remember their dreams. It's why in my ketamine infusion clinic, I do not use benzodiazepines, because I don't want to risk losing the self-forming memories or the experience that can help provide future healing. So it's funny, when we use ketamine in the operating room, sometimes we purposely give midazolam to help prevent vivid memories, vivid dreams from being remembered. But if we're using it for psychedelic healing purposes, we want to avoid giving it. Kathy, thank you for bringing up your question again there. I wish everyone the most empowerment to help you heal yourselves with medications when necessary, but hopefully with fewer than you had before, because you have, like I said earlier, more power over your health than you've probably been told. Until next time, take care, everyone.